and welcome to Medical Talk. I'm your host, Betty LaMarr. We are talking today about the D word, and it's diabetes, and we're bringing awareness to diabetes with the pros from AM Diabetes Centers of America, Janet Butler-Curtis and Kent Stoneking. Hello, everybody. Thanks for tuning in, or welcome to Medical Talk.
Thank you for having us, Betty.
Thank you, Betty.
Okay, well, we're going to get this started. I want each one of you, starting with you, Janet, to tell our viewers who you are as it relates to our topic today.
My name's Janet Curtis. I am coming to you not only as an employee of a diabetic center and a practice administrator, but I'm coming to you as a mother of a type 1 diabetic. Our youngest daughter, who's now 25, Katrina, was diagnosed at the age of 11. And so there's a lot that goes along with that, but it was August the 13th, 2011, when our lives and the diagnosis changed our lives.
Okay.
And I'm Kent Stoneking, and I come to diabetes. I was diagnosed at age 11, February 11th of 1979.
Wow.
Which means that today
That's right.
is my 44-year diabetiversary.
Wow.
I've been involved as a patient in clinical research for many years at the UT Health Science Center. Landmark studies, they had us doing things back in the early to mid 80s, early 90s that people with diabetes were never doing. The outcome of all of that research was transforming how type 1 diabetes is treated. And as a patient in that environment, I was privileged to be doing things that people had never done before, rendering blood glucose levels that were ordinary for people without diabetes. And from that, learning how to avoid complications. I learned how to care for myself then, and I'm still doing the same things today. So very privileged to be here. Thank you.
Wonderful. Thank you so much. This is so exciting. You know I'm always into diabetes. Well, diabetes, my daddy and his mother sort of kind of in the genes. I just decided that I wasn't going to claim it, but it's heavy on my dad's side of the family. They used to call it sugar.
Sure.
She had sugar, or he had sugar. So Janet, let's start here. Now, you know, I'm well aware of AM Diabetes and Endocrinology Center.
Correct.
So why don't you tell our viewers the difference between AM Diabetes and Endocrinology Center on Cape Bond versus AM Diabetes Centers of America?
I'd love to share that with you.
Okay.
So we at AM Diabetes Centers of America, there's many facets to it. Our first facet is, of course, patient care. Another facet that we have is our educational department is centered within AM Diabetes Centers of America. Kent is actually our Director of Education and Self-Management Care Program. So we have, that's a big part of what we do. You do not have to be our patient to come and be a part of our education. Our education program alone has shown to drop an A1C of 1.3, which is tremendous. If you're familiar with what an A1C number is, it's incredible. That is just, we want to share that with the whole tri-state area. Even people outside of the tri-state is our goal. But let me tell you that it makes a huge difference at class. So educating patients is a big part of AM Diabetes Centers of America. We want to be, we actually on Cape Bond have the nation's first and only insulin pump center.
Yes.
So it's where anybody that wears an insulin pump has their own location to go to. Having an insulin pump center has also shown to drop an A1C by 0.8, and so we've carried that and tracked it through all these years, and keeps it down. That gives them their own point of entry. It gives them their own telephone numbers. They can stop by at any point, have their insulin pumps downloaded, have a doctor review it. There's no charge. We just want to make sure that they're at their top care. You can also send those numbers in electronically these days through the web. The other things that we do, we offer an implantation of a controlled glucose sensor. It's called Eversense, and we'll do that procedure for you. So your provider can just recommend you over. We'll take care of the diabetes portion. We just want to help assist the providers to help their patients get their best care. So another part, Kent, I want you to just kind of share the other aspect that we have. So we've got the implantation. We've got, tell about the infusion that's part of,
it's exciting.
Of what you do.
Yeah.
So
it's
yeah,
exciting.
let's explain
We
that.
have a research center, right? How many doctors' offices have a research center in their office?
AM Diabetes Center?
There you go. You named it. That one. Dr. Latif is very keen on research, and he's partnered with a number of pharmaceutical companies and device manufacturers to do research. And one of those very exciting pharmaceuticals is a product called teplizumab. That's what pharmacists say. Everyone else says Tzield. Tzield is now commercially available. He did some of the pre-approval studies with teplizumab, and this is an exciting infusion, Betty. It allows people who are not fully diagnosed with type 1 diabetes, but they're well on their way. I'll back up just a step and explain that type 1 diabetes is really an autoimmune process.
Okay.
So if you take someone who perhaps has a family history, if they demonstrate that they have at least 2 autoantibodies to their own insulin, and their blood glucose is not diabetic level yet, but starting to move off the mark, those are prime candidates. If they're at least 8 years old, they can receive these infusions once daily for 14 days. But what that does is it basically shuts off that autoimmune process and preserves their ability to make insulin.
Wow.
So they never convert, or at least not as rapidly convert, to full-blown type 1 diabetes. It's huge.
That's amazing.
By preventing diabetes, you really prevent the complications of diabetes, and that's the big win. Because diabetes is the leading cause of new cases of blindness every year in the U.S. It's a primary cause of kidney failure, non-traumatic limb amputation, and for type 2 patients, it's a huge driver for heart disease.
Okay.
So we're going a long way with education, with these infusions, with the insulin pump center, helping patients stay on track.
Okay,
in the long run,
question.
preventing those complications.
Speaking of the research, will the research department now move to AM Diabetes Centers of America, or will it remain on Cape Bond?
We will have some at both locations.
Okay, you will.
We will.
Okay, now let's go into the education, because a lot of people don't understand. It amazes me how many people I speak with that are living with diabetes that have never attended a diabetes sub-management class. So take us there and tell us about exactly, okay, I come in, I call, I sign up or whatever, register. Take me to when I first walk in, sign up for the class, where do I go from there?
Great question, Betty. And really, the diabetes education is for everyone. But people come at diabetes from a variety of angles. There are people with type 1 diabetes, usually children, where the body's just quit making insulin. There are many more people. That represents about 5% of all people with diabetes. The other 95% are people who develop diabetes during their lifetime. And that's a very different, the medical word is etiology, the pathway to that disease, but the outcome is the same. They still have to manage glucose, but it's different.
Okay.
There are people who develop diabetes during pregnancy. There are people who might have cancer and because of high exposure to steroids wind up with diabetes.
Wow.
Sarcoidosis, there's various high exposure to steroids can drive people into diabetes. So there are a number of ways to get there, but once they're there, we all need to be doing the same thing. We need to understand how to eat properly.
Yes.
Diet's a 4-letter word. We try to avoid that word. We favor the term meal planning.
Yes.
And I've learned as a diabetes educator over the past almost 28 years that is the most misunderstood aspect of diabetes care. What in the world do I eat? How much can I have? Can I enjoy my favorite whatevers? The answer is yes, by the way. But we figure out how to factor that in.
Okay.
Medications, physical activity, exercise. In fact, if you just took diet and exercise, those are the foundations of diabetes care. Those are the foundations of good health.
Yes.
No matter what, as a
Period.
pharmacist, we can pile on top, medication-wise. If you don't have the diet and exercise right, none of the rest of it's going to work, at least not for long.
Okay.
So we teach that.
Now, you mentioned something, and I have to go back so I won't forget. You mentioned something very important. We all need to eat healthy. So at some point, will AM Diabetes Centers of America just offer nutrition classes for, say, like somebody like me that don't have diabetes, not living with it? Hopefully I won't claim it. But still may need nutrition.
We already
training in
do.
nutrition.
We already do. We have a licensed dietitian, Hannah White, on
Perfect.
staff.
Okay.
And you can make appointments with Hannah just to do, we call it medical nutrition therapy. It's covered by insurance, and she'll sit down and answer any questions you might have about how to eat right.
One exciting thing in the future is a teaching kitchen.
Yes.
So we are
wow.
looking to having a teaching kitchen as well with AM Diabetes Centers of America.
That's amazing. We need to bring the cameras out for that for sure, right?
Yeah, right.
Yeah. So Janet, tell me, we're going to go back to education because we still have the second half of the show. We're going to really delve into that even more because that's so important. Tell us, our viewers, a little bit more about what Janet Curtis, exactly what your, because I know you.
Yes.
You're the most focused, organized person that I've ever met. So tell me exactly what your role is at the Centers of America.
So my role will be practice administrator.
Okay.
I will be overseeing the clinic as a whole. Another part that I did not actually mention yet is we're going to have an acute care center. So let's say you wake up in the morning, you have a 400 blood sugar, and you know, instead of going to the hospital for it,
Yes.
you can come to us. We can take care of you. We can bring that sugar down. We had one happen just a few weeks ago. Somebody came into our clinic. By noon, they were going home. So that saves that stay. It gives you a much more comfortable environment to be in.
Yes.
You know, and
Versus
we can
the emergency room.
Oh, and
Right.
the cost of the emergency
Yes,
room,
oh my
because you're
God,
paying a
yes.
copay as opposed to,
Yes.
you know, paying an emergency room bill. But so I'm going to oversee all of that that's transpiring. We have a great group of dedicated people that will be there to serve you and bless you. And it's just my goal to keep those group of people just serving you and coordinating and keeping it all flowing well.
Okay, so now my dad, a few days ago, my sister, you know, she lives with my dad now, since he had a little tumbling fall. So she mentioned that his sugar was 300. So is 300 considered what?
That's 3 times what it should be.
Okay. Because see,
Really?
to her, it was like no big deal. But I guess because I work around and hear the numbers, and I have to study it really in order to even post something about it on Facebook or whatever, on social media. So when we come back after this break, we want to go back into the A1C again and the numbers so we can let people know, when do you really need to call us? What is considered, when do you know if 300 is out of bounds or not, okay? And then we're going to get into that because I want to know more about A1C and all those wonderful devices. We'll be right back with more medical talk. Watch this space.
You're watching the award-winning GHS TV.
Hi, I'm Angelica reporting live from LaMarr Productions in East Memphis. Thanks for watching Let's Talk with Betty LaMarr. Betty is renowned for her successful medical talk show, and now you're invited to watch the space for her new production, Let's Talk, which is laser focused on issues affecting young girls and women in the community. Now, back to Let's Talk with your host, Betty LaMarr.
Welcome back to Medical Talk. I'm your host, Betty LaMarr. We're talking about diabetes, and I'm here with the pros from AM Diabetes Centers of America. Okay, now, Janet, Kent, we're back. I need to know, we left off with, you know, talking about A1C, but that automatically sort of kind of got my brain ticking about, let's talk about the difference between type 1 and type 2 for those people that don't know the difference.
Yeah, because a lot of people just assume type 2 because that's what the world's familiar with.
Yes.
As Kent said, type 1 is about 5% of those who are diabetic. So what we are familiar with are the type 2s. It's typically a sedentary lifestyle. As you get older, a lot of times it onsets. And it's typically tied to activity level. And it could be family heritage too as well.
Okay.
That factor in there. Type 1, so I've always told people this is the layman's term. Can't tell you the scientific aspect,
Okay.
but layman's term, I always say, you know, my daughter is a type 1 diabetic. That means she could exercise 24 hours a day.
Okay.
She could eat nothing but carrots. She's going to die from a high blood sugar
Okay.
without insulin being injected continuously into her body, either
That's right.
through an insulin syringe or through an insulin pump. So
Okay.
that's the difference in the two. Now, some type 2s do use insulin as well.
My dad does for some reason. I don't know why.
And that's just part of the progression of the disease. But I'll let Kent tell you kind of a little bit more scientific version of the
Okay.
difference.
And we alluded to this a few moments ago, but really type 1 is an autoimmune disease. For whatever reason, the body's own immune system recognized the insulin-producing cells, the beta cells in the pancreas, as an invader and attacks and obliterates those cells. Usually there's an exposure to a virus of some kind, maybe not even an illness, but that viral exposure causes the immune system to create antibodies, and antibodies do what they do best. They eliminate that virus, but they also attack other things that resemble the virus. There's kind of a genetically driven component to that too, because some people's beta cells resemble viruses more than others, and so the immune system will recognize those, develop those antibodies, and then over a period of time obliterate those insulin-producing cells. So people like Janet's daughter, people like myself, our bodies just quit making insulin because our own immune system destroyed its capability to make insulin. So again, exercise won't do it, eating nothing won't do it, because we have other hormones that will release stored glucose from our liver, from our muscle cells, to maintain the level of glucose, but without that check and balance of insulin, it's just going to continue to escalate unchecked. Type 2, on the other hand, begins with a resistance to insulin. The body's making plenty of insulin, but let's talk for a moment about what insulin really does. It moves glucose from the bloodstream into cells where it can be used for energy, and glucose is our body's primary source of fuel. So it's very important to be able to have glucose available for energy, but it's got to get into the cells to do that. So cells have a series of, we'll just call them doors, little doors on those cells, and they open and the glucose goes in and insulin opens the doors, and that works real well until one day, we'll just say the hinges on those doors start to get a little bit rusty. They still open. It's not an all or none proposition, but they just don't open as well as they used to. So the body responds by saying, okay, the doors aren't opening quite as well. Let's make more insulin to force them open. And there's an overproduction of insulin. Well, as there's more insulin produced, believe it or not, more rust accumulates on the hinges. And it's just kind of this chase. Insulin resistance is what we call the rust on the hinges. And then insulin production is trying to keep pace with resistance. But eventually production can't keep pace, and those insulin producing cells start to wear out. When they wear out, they die out, and Betty, they don't regenerate. That's why your dad with type 2 diabetes is on insulin, because his ability to make insulin has been diminished by trying to keep pace with resistance. The beautiful thing is we have a number of medications now, if we can catch it before we get to that point, that can prevent the need for insulin, or at least push it way, way out. But there was a doctor from Harvard years ago who set the diabetes care world on its head. He said, you know, type 2 diabetes patients, if they live long enough, eventually they'll all need insulin by injection just to keep a balance.
Okay. So let's talk about the ADA, American Diabetes Association. I know you all have to have some kind of special accreditation, if you will, or whatever, to do what you do. Tell us how the ADA plays into diabetes education.
Absolutely. So ADA has a very rigorous, they call it a recognition program, and our education program has to meet certain criteria per their guidelines in order to be recognized. And our educator, Terry Moore, Terry's an RN, longtime educator, wonderful lady. She has worked very diligently to bring our program up to that standard. And she's been at AM Diabetes for years and has achieved and maintained that standard over the years. As you can well imagine, there's a lot of documentation that goes into accreditation, reaccreditation, maintaining that, but the program, the excellence of the program that she's developed has been able to maintain that, and that's the highest recognition for diabetes education programs in the country.
Okay, and so speaking of Mrs. Moore, so will Mrs. Moore continue the diabetes education on Cape Bond, or will she be with AM Diabetes Centers of America?
We are going to be able to offer it in different locations.
Oh, wow, that's what I was
Yes.
trying to get to.
Yes,
Okay.
yes. So we will be different locations. We have plans to go to people at some point. We will be, it's
Like
in the
homebound
plans.
people?
It's in plans as far as different ways, maybe even through electronically plans.
Yes, virtual
So
education is
virtual.
covered, just like live education.
Okay.
And you know, COVID did a number of things that were actually beneficial. It taught us how much we could do virtually.
That's
And so
right.
virtual education, just like telemedicine,
Correct.
is now a covered benefit. So we can take our team wherever they are and really expand our influence. We're also adding to our team, Betty. So there are a number of really good educators in the city that may or may not be doing education as their full-time job, but that are eager to educate patients because it's such a need, especially
Yes.
here.
Yes.
If you were to look up the American Diabetes Association on the internet and look at their heat map for the entire U.S., the Memphis Mid-South area is at the epicenter.
It's hot.
It is hot.
Oh, God.
And I mean, people here, you either have diabetes or you know at least one other person who does. So we have a huge job to do. And Terry gave me this number. She researched it. She said there's 60% of people with diabetes that have never had education, not the first bit. The people I meet, I tend to think that number is probably higher, but that's the number that's been published, 60%. And of those who are educated, if it's been 6 months since their education, they've fallen off the wagon. Frankly, they've forgotten most of what they learned. We're busy people. So to educate people early in their diagnosis, preferably as soon as possible after diagnosis. Say, okay, you have diabetes, don't panic. We've got you.
Right.
And we're going to walk you through this process, teach you what you need to do.
And can you imagine, though, taking that 60% of people and educating them and bringing their A1C down 1.3 from that education? You know, and that's an average, so some are going to drop more than that. So what a difference that's going to make in their lives.
A big difference. Okay, I'm enjoying this so much. When I have follow-up, that means I'm really getting some good stuff. So how often should a person, say like I was diagnosed with diabetes, okay, I went to AM Diabetes Centers of America, I had this wonderful class. Now, as he mentioned earlier, 6 months later, whatever, you drop off the wagon. So how often should a person refresh?
Good
Because
question.
technology and everything
Yeah.
constantly change. Our food choices change.
That's right.
So how often?
At least once a year.
At least once a year.
At least once a year. Medicare covers up to 10 hours of diabetes education in the first 12 months after diagnosis and 2 hours of re-education every year thereafter. So we have a huge opportunity, Betty, to reach out to people and to continue to cultivate their knowledge. And really it goes beyond education, it's empowerment. Because
Okay.
we're handing you the keys to drive this yourself, because you'll have to if you're going to be successful. And then we stay, as Janet mentioned, we remain as your backup, as your resource. We're here for you, just to keep you on the path.
Yeah, that's where that word self-management.
That's
Exactly.
correct. That's
Okay,
correct.
then now
Exactly.
that all that really makes sense. You give them the tools they need
That's it.
to manage, but of course they know you're always there.
Yes.
Because I just think, like, in my family, I don't really know if my dad has ever had diabetes self-management. Now, he's very careful about what he eats. But back in, he's like 87 now, but back, many years ago, there wasn't any such thing. You just had sugar. So as you get older, you sort of, as we say, you get sort of set
Yeah.
in your ways. So now probably the chance of getting him in a class, that's where virtual will come in handy, because my sister can sit him in front of the computer so he can learn.
Right. Now, let me tell you something else that's really neat.
Okay.
So it's not only you that can come to the class or your dad that can come to the class, but he can bring a support person with him to the
Absolutely.
class.
In fact, that's
So
even
whether
better.
it's a spouse or your
more
sister, or his daughter to come with him.
Okay.
Somebody can come and attend that class. So since she lives with him, that would be the ideal person to go and also be educated with him to know exactly how to handle his diet and encourage him along
It
the
also
way.
builds in a layer of accountability, which is always a good thing.
Yes. Now, this is another big question. I know it's still a little early in the game, but what is your overall vision right now for, because when I see AM Diabetes Centers of America, my scope is outside of where we are right now. I think
Absolutely.
America. So what is the vision for now? Because I know it's going to expand. I know the medical director, okay? I know how you all roll. So right now, today, what is the vision for the diabetes education and everything else that you all will be doing there or are doing there?
Yes, so our vision initially, we will be starting out on Poplar. We have multiple other sites that we are looking at to
Okay.
expand into, mentioned as a tri-state area, but that vision's not limited.
Yeah, because I really think that it would be a good idea eventually, because like my family and a large demographic of people
Yes.
of color,
Yes.
those areas. I think it may be a little bit easier to get them into a class if they could get there.
Right.
You know what I mean?
Right.
If they could just, if it was someplace close where they can attend, because I'm in Whitehaven, but it's just like,
Access is very critical.
Yes.
That's why we're looking at.
yes.
We want to get our
various
arms around the Memphis Mid-South area
Yes.
primarily because that's the epicenter. And then from there, build a solid base from where we can branch out and have impact in other parts of the U.S.
Okay, now, since we're about to go off the air, right? I want both of you just to just tell our viewers what they need to know in just these few seconds that we have. Where you located, a phone number, email, anything that they need to get in touch. And of course, we'll put it on the screen later.
Sure. So AM Diabetes Centers of America, we are located at 6401 Poplar, Memphis, and in the Penmark building. So if you're familiar with the Penmark building across from International Paper area, that is where we are located.
Okay, perfect. And what do you want to say really quickly about the importance of that education class?
There are more people that need education than ever imagined. If you wonder if you need it, go to the American Diabetes Association, diabetes.org, and look up risk test. And it will amaze you. You think, oh, I'm not at risk. You very well may be and not know it. So take the risk test, and if you qualify, call us.
Okay.
We will help you.
Okay, this was really wonderful, and I thank you all so much. And I would like to thank everyone for tuning in every Friday night at 9:30 p.m. on Channel 17 for Medical Talk. We do try to bring, I would say, some of the top professionals in the community to give you the tools that you need. And something I'm going to piggyback, Kent, when I asked about when does a person know, I think that if you have not attended a diabetes education class, that is already an indicator that you need diabetes education. So again, I'm Betty LaMarr, and from all of us at GHS TV, we would like to thank you for tuning in, and we look forward to seeing you again soon.
Thanks for listening to Conversations with Betty LaMarr. Visit our website, www.thebettylamarrshow.com. Email betty@thebettylamarrshow.com. Subscribe to our YouTube channel, Betty LaMarr Memphis. We'll talk to you next week on Conversations with Betty LaMarr.